everyone, my name is Ranjan Argota, and today I'm going to assess the cranial nerve. Bring introductory phase. Review the client's medical records and doctor sheets if it is available. So the rationale for this and checking the medical records of your patient is for you to know the health status of your patient. So the next thing that I'm going to do is I'm going to determine the assessment needed and prepare all the equipments that are needed for the assessment. So the rationale for that is to prepare yourself before performing the assessment and prepare all the equipments or paraphernalias that are needed for the assessment. So the third step that I'm going to do is I'm going to wash my hands or perform the hand washing procedure and perform hand hygiene. So since my hands are now clean, I will perform the hand hygiene. So the rationale for this is to prevent the spread of microorganisms and to prevent the cross-contamination. So introductory phase, greet your client politely and introduce yourself, identify client's identity, and build a rapport. So, ma'am. Hello, my name is Ranjan Argota, and you can call me Rain. I'm your student nurse for today. So, ma'am, how are you today, ma'am?
Good.
You're good. Okay. Ma'am, can I ask you some question? What is your name, ma'am?
Catalina Mercado.
So, how old are you, ma'am?
44.
Do you have any health history? Which language do you prefer? Do you prefer Bisaya, Tagalog, or English?
Bisaya.
Okay. Ma'am, kanang mangutana ko sa imo ha ba? Unsay mo gusto na itawag sa imo ha? Well, magduwa ta sa assessment.
Kat.
Okay, ma'am. So, the rationale for that is to establish good relationship and supportive relationship with your client. So the next step that I'm going to do is I'm going to explain to my client what are we going to do with the assessment, and I will ask my client on how he or she could participate during the assessment, and I will allow my client to ask questions, clarify questions, and raise any concern. So ma'am, the assessment that I'm going to do for you today kay mag-assess ta sa imuhang cranial nerve. So, tapos, napa kay mga questions regarding sa ato ang assessment or okay na sa imo hatanan? Wala na. Okay, thank you, ma'am Kat. So the rationale for that is to for you to gain information and your client also can receive information from you, and also asking the client that if she has questions is to answer client's questions that she wants to be answered. So that a third step that I'm going to do is I'm going to examine the hospital setting, and I will ask my client about the privacy, the confidentiality, and the comfortability of my client. So ma'am, are you comfortable with closing the door, the window? Are you okay with the room temperature? We could pwede na to siya i-adjust if you want.
Okay na.
Okay na. So, the rationale for that is to ensure the client's comfortability in the hospital setting and to ensure that your client is well safe in the setting. So, let's proceed to the working phase. So, the first cranial nerve that I'm going to perform is the olfactory or the cranial nerve 1. So, I'm going to ask the client to clear his or her nose and remove any mucus, then occlude any and nostril, and identify a scented object. So, ma'am, can you please clean your nose? Is your nose limpyo na imong ilong, ma'am? Okay. So, ma'am, maghatag ko sa imo og isa ka object, and then I will let you identify what the smell na akong gihatag sa imo. So, I'm going to close the other side of your nose, which is the left one, and I will let you to can you please close your eyes and then identify what smell is that? Unsay ang iyang baho? Okay. So I will perform also in the right other side of the nose of my client. So, ma'am, unsa lang? Okay. Okay, since my client identifies it immediately, so it means my client has a normal findings regarding with the olfactory. So the rationale for that is to mediate the sense of smell. So let's proceed to the cranial nerve 2, which is the optic one. So to check the visual acuity of my client, I'm going to use as a pocket Snellen chart, and I will give it to my client and ask my client to read aloud which printed in the Snellen chart. So ma'am, can you please cover your left eye and then read basaha kung unsang nadira mo.
P, Z, P, O, C.
So well good. So other side of your okay.
E, T, O, F, E.
Okay. So since my client can identify what's in the Snellen chart, so the rationale for this is to check how well a person can see a details of a letter of a symbol from a specific distance, which with help of the Snellen chart. So let's proceed to the cranial nerve 2 or the optic 2. Optic 2, yeah. To check for the visual field, face the patient directly into your face, and then ask your client to look into your eyes into the bridge of your nose. So ma'am, can you please move the gamay, ma'am? So I will can you please ma'am look into my diri sa ako ang nose or sa akong side? Yes. Side sa akong sa bridge sa akong nose or sa akong eyes. And then pag imagine ma'am na naakay dako nga bowl diri sa imong ulo, and then I will place my hands sa kilid, and please identify if my hands are moving or not, or makita niyo siya. Okay? So is my hand moving, ma'am? Kita niyo akong hands na nag-move. Ano niyo siya, na ay one sense na mag-move. So here. Yes. Okay. So, ma'am, i-perform na to siya. So, can you cover again your left eye? And then, kani ma'am. So, diri. Ano ma'am? Remain. Kani? Tanaw lang sa kuha. Okay, so other side. Diri. Okay. So since my client identified my hands that are moving, so my patient identifies them, and then I already repeat the upper and the lower quadrants of it. So I'm going to determine the rationale for this is to determine the function of the retina and neuronal visual pathway to brain, and second optic cranial nerve of the eye of my client. So ma'am, move na sa gamay ma'am. So let's proceed to the cranial nerve 3, 4, and 6. The oculomotor, the trochlear, and the abducens. So I'm going to check the upper eyelids while the patient is looking directly at me. And I'm going to check the vision of it. So ma'am, can you please look into the wall, and then I will going to check the pupil or the eyelids of your eyes. So the eyes of your client must be symmetry, and you're gonna check for the size and the line of the eyes of it. So okay, so the next is I'm going to check the size and then the papillary of the eyes of my client, the reaction by shining a light on it. So I'm going to check the eyes of my client first with a light. Okay. Since the eyes of my client, or the size of the eyes of my client is now same, it's normal. So let me try checking the eye of my client in a dark face. So the difference of this is to by using the dark light is that you can clearly see the pupil of your client. So the rationale of this is to next is to test accommodation and convergence of near vision and subject's ability for follow objects with the eye. So the next is, ma'am, can can you follow my hands? Okay. So I'm going to perform the 6 gaze. So going to perform the 6 gaze. Follow my hands while I'm moving it. Again. So my client clearly identify or follows what movement that I am doing while doing the assessment. So the rationale for this is to determine the eye alignment and coordination of the eye of my client. So now let's proceed to the cranial nerve 5 trigeminal. The mandibular, maxillary, and ophthalmic division should be tested symmetry for pain, light touch, temperature. So I'm going to use a cotton, and then I'm going to use a sharp thing to test if my client can feel pain. So I'm gonna do this first for pain. I'm going to use sharp. Ma'am, can you please close your eyes because I'm going to test for pain in your face. So, does, okay, remain closing your eyes. Is the thing sharp? The thing is sharp. Okay, so I'm going to use another. Is that thing sharp or not? It's smooth. Okay. So I will let you identify if the thing that I've used is sharp or not, and you will tell me, or did you feel if same ba? Same or not? No. Can you please close your eyes? Same or not? Same or not? Okay. So since my client identifies that she immediately identify if she feels sharp or not. So I'm going to ask my client to please use the the rationale for this is to stimulate the movements, and then I'm going to proceed with the cranial nerve trigeminal 12 also for using a wisp of a cotton. So to test the scattered areas to compare sides. So I'm going to use a wisp of the cotton. So the rationale for this is to stimulate movement and test the light touch. So I'm going to use a cotton, and then I will tap this into your face, and you will tell me if you feel it. Okay, ma'am? Can you please close your eyes? Same. Again. Same. Same na. Dili. Dili. Cover your eyes. Same na. Ang iyahang same na. Okay. Close your eyes again. Same na. Okay. My patient identifies the object immediately, and it's clear that my patient has a normal findings with touch of light. So the next step that I am going to check is I'm going to check for the cranial nerve 5, the trigeminal. I'm going to check the corneal reflex of my patient. Ask the patient to look away from you and approach the patient from the side of his line of vision and lightly touch the cornea with a fine wisp cotton, which is this. And now, ma'am, pwede kang tanaw dito sa kilid. Okay, sa other side, ma'am, please. Okay, so the rationale for this is to identify the facial symmetry of movements of my client. So the next step that I'm going to do is I'm going to assess the cranial nerve 7, which is the facial. So I'm going to ask my client to smile. front, show the teeth, puff her face, upper lip, raise her eyebrows like this, and close her eyes tightly, and then tightly resistance. So ma'am, pwede ka mag-smile. Smile. And then, pwede ka front. Okay. Sukuin mo na. Okay. So, ano na po ka mag-show teeth. And then, raise your eyebrows. Ang pasing kilay. And then, close your eyes tightly. Close your eyes tightly. Very tight. Okay? And then, purse your lips. Pout your lips. And then, lastly is to smile again. Very, very smile. So the rationale for this is to identify the facial symmetry and movements of your client. Normally, the normal client can do that immediately. And then, let's proceed with the cranial nerve 8, which is the acoustic vestibular. So, the first step that we're going to do is we're going to test for the whisper test. So, test one ear at a time and occlude the patient's ear with a finger. So, I'm going to tabunan ako ang iyahang isa ka ear, and then I'm going to whisper words like 99 or baseball. So, test I'm going to stand 1 feet away from my client, and then I'm going to conceal my mouth to prevent lip breathing, or taguan lang akong mouth here to the side of my client, and then I will let my client identify what word did I pronounce, and I'm going to ask my client to repeat it what I have whispered. So ma'am, tabunan ako yung mga left ear, and then mag-whisper ko, and I want you to repeat. Okay.
99.
Okay. So the other side.
Baseball.
Okay. Since my client identified what words that I've spoken, the rationale for this is for detecting hearing loss or to assess for hearing. So let's proceed for the cranial nerve 8 also, the acoustic, the vestibular, and then we're going to proceed to the Weber's test. So to the Weber's test, we're gonna use the turning fork. So since that we are in quarantine right now, I do not have a turning fork like in a hospital. So I prefer the literal fork. So to perform the Weber's test, I'm going to use a turning fork and place the base or this in the upper head of my client, and let my client ask my client if she can hear the sound louder in her ear when I place the turning fork in the upper head of my client. So, can you hear it? Is it loud? Is it loud? Again. Is it loud? Okay. So the rationale for this is to test the lateralization of the test of asymmetrical hearing loss of the patient. So let's proceed with the cranial nerve 8 again, acoustic vestibular ring test. So we're going to perform the ring test. So I'm going to place a vibrating turning fork and mastoid process behind the ear of my client, which is here in this part. And when the patient indicates that sound is no longer heard, quickly place the vibrating turning fork in the near of the ear canal of the client to be sure to also to check the opposite ear. So I'm going to vibrate again. I'm going to use the turning fork again, and then I'm going to place it here. Is it vibrating? Do you hear it? Is it loud? Okay. Other side. Do you hear it? Is it vibrating? Tell me if wala na siya vibrate. Do you hear it? Is it loud? Okay. So since my client replied that in every way that I'm checking the client's ear, she responds immediately. So the rationale for this is to compare air and bone conductor. So let's proceed to the cranial nerve 910, the glossopharyngeal and the vagus. And now I'm going to ask my patient to say ah. Wait lang ma'am. Open sa ko tongue depressor. And then, ma'am, can you please say ah? I will just get my pen white. And I'm going to assess for the voice of my patient if it is forced, and palate the uvula. And again, ma'am, say ah again. Okay, so I already inspect the anterior and the posterior area of my patient, and I will just place this tongue depressor here, the unsterile tongue depressor, and I will put the findings. So the rationale of this is to check the mass and any inflammation in the mouth of my patient. So I will now proceed to the cranial nerve 9 again and 10, and I will get another tongue depressor, because we cannot use same depressor in our patient because it's not sterile. So test the gag reflex of one at a time using a tongue blade or tongue depressor, and then after that ask the patient to stimulate back of the throat and lightly each side in turn. So you should see a rise in our palate and be down without any difficulty to swallow his or her laway without difficulty. So ma'am, can you please open your mouth again because I'm going to check it again. Can you swallow? Okay. So if your patient swallow immediately, it means that your patient is free from any masses and inflammation. And the rationale for this is to check mass effect of inflammation. So let's proceed to the cranial nerve 11. So the spinal accessory. So open the patient's gown to reveal the upper trapezius muscle. Ask the patient to shrug his shoulder like this, upward against your hands, and evaluate the strength of construction of the upper trapezius muscle. Ask the patient to turn his or each side against your hand and observe the construction. So since that I am having a patient female, so I will just consider this excuse. So ma'am, can you please shrug your shoulders like this? And we'll check the strength of it. Can you do like this? Okay. So the for the opposite sternal muscle, I've noticed that the force of the muscle of my patient is very strong, and the rationale for this is to identify its function, strength in innervating sternocleidomastoid trapezius muscle. So the next step that I'm going to do is the last step, the cranial nerve number 12. The hypoglossal. So I'm going to ask the patient to open the mouth and assess for tongue atrophy and fasciculations. And I'm going to ask my client to stick his or her tongue out like this for any symmetry and division from midline to tongue to tongue, and should protrude straight out. So ma'am, kanang pwede nimo igawas imong dili ganin. Okay. Side. Move your tongue side. Other side. Open your mouth. Go sa dila. Okay. So, I already checked the symmetry of my client, and and as what I've seen, it's normal. So the rationale for this is to check the movements of the tongue muscle. So, we are now done doing the assessment regarding with the cranial nerve. So for the closing phase, I will can you please move to that side? Okay. So now I'm going to summarize. I will inform my patient that the assessment is already done. So ma'am, thank you for your participation. Our assessment is already done. So before ending the assessment, please summarize all the information that you have gained from your client. So the rationale for that is to let your client know what is his or her findings or just a summary of it. So thank the client for participating during the assessment. Ma'am, thank you for participating with our assessment. I highly appreciate it, and I hope that you have a good day. And let your client go parang ayusin niya self so he or she could go home. So again, my name is Rinjan Sairi Argota from BSN 11E, and now I am done performing the assessing the cranial nerve. Goodbye!